What makes specific bacteria trigger childhood diarrhea? Imagine a tiny invader sneaking into a child's body and causing a big upset in the stomach. That's what some bacteria do when they trigger diarrhea in children. Certain bacteria like Escherichia coli, Salmonella, Shigella, and Campylobacter are common culprits. They usually spread through contaminated food, water, or contact with infected people or animals. When sanitation is poor and clean water is hard to find, these bacteria find it easier to cause trouble. Each of these bacteria has its own way of making children sick. Shigella bacteria, for example, infect the colon, leading to symptoms like fever, stomach pain, and sometimes bloody diarrhea. Shigella is very contagious, and only a few bacteria are needed to start an infection. It spreads quickly in crowded places, especially where hygiene is not ideal. Some strains, like Shigella flexneri, can even cause complications such as joint problems called reactive arthritis in children. Escherichia coli is a large group of bacteria, most of which are harmless. But some types produce toxins that damage the lining of the intestines. These harmful strains can cause severe diarrhea, especially in young children whose immune systems are still developing. They often get these bacteria from contaminated food or water, making children more vulnerable. Salmonella and Campylobacter are often found in undercooked chicken, eggs, or unpasteurized milk. When these bacteria enter a child's digestive system, they invade the intestines, causing inflammation, pain, and watery diarrhea. Sometimes, the infection can spread beyond the intestines and lead to more serious illness. When bacteria invade the intestines, the body's immune system responds by trying to fight the infection. This response causes inflammation, which disrupts how water and nutrients are absorbed. As a result, children get loose, watery stools, which is what we call diarrhea. If a child is already malnourished or has a weak immune system, this can lead to dangerous dehydration, which needs urgent medical attention. Preventing bacterial diarrhea involves good hygiene practices like washing hands thoroughly, especially before eating and after using the bathroom. Ensuring access to clean water and safe food handling are also key. Vaccines can protect against some causes of diarrhea, like rotavirus, but not for the bacteria discussed here. Treatment usually involves giving children plenty of fluids to prevent dehydration. Sometimes, antibiotics are needed, but only under a doctor's supervision because improper use can lead to antibiotic resistance. In summary, specific bacteria cause childhood diarrhea by invading or damaging the lining of the intestines, leading to inflammation and disruption of normal digestion. The risk increases in places with poor sanitation and in children who are malnourished or have weaker immune systems. Protecting children involves good hygiene, clean water, safe food, and appropriate medical care. Always consult a healthcare professional for proper diagnosis and treatment tailored to each child's needs.